Okay, in this chapter we're going to cover bandaging. So, bandaging wounds. And this is going to correspond with chapter 10. If you're reading along in your book or using your book to follow along. And this is more of a skill-based chapter. And so what I'm talking about is there's a lot of information where they're classifying dressings and bandages and stuff like that, and that's what I'm going to cover in this video lecture. But there's a lot of skills also in this chapter, which we will have other videos about, and I'll show you my favorite ways of dressing or using dressings and bandages. So there are some that I like better than others just because I have more experience with them and they've worked well. So let's talk about types of dressings. So types of dressings. So on the dressings, all should be sterile. I shouldn't say all, most. Let's scratch that out. Let's say most should be sterile, unless the package has been contaminated in some way, maybe it's broken open. You're going to have gauze, and I've talked about gauze in other chapters and how it's designed, especially for bleeding and to stop bleeding. This is good for small wounds. It depends on the type of gauze you have. There are different types of gauze, but the ones that you're going to get in most first aid kits that are pretty thin. They're not very absorbent, so they're good for small wounds. And some have a special coating on them, and that's to prevent it from sticking to the wounds. And then you have adhesive strips. And when we're talking about adhesive strips, they'll stick to the skin. So something as simple as a Band-Aid would be an adhesive strip. So it typically it's good for small cuts. And a lot of this is common sense, good for abrasions. So you have some sort of adhesive with a little bit of gauze attached to it. And then you have trauma dressings. And these can be really good for external bleeding. So they're large, they're thick, they're absorbent, and that's key, especially for external bleeding. And you've got to be careful with trauma dressings because they're not always sterile. So they're not always prepackaged, and not all of them have been sterilized. So you got to be careful using these dressings. You know, a lot of the gauze pads and the adhesive strips that you're going to use have been sterilized, but not all trauma dressings are. So they can be clean, but that doesn't always mean that they're sterile or have been sterilized. If you don't have trauma dressings or any of this other stuff, you can use cloth. You just want to make sure it's clean, that it doesn't have a lot of lint left behind, it doesn't have anything on it that's going to get in the wound. So you use what's available to you, and you use what's the best choice. But you can use cloth, you can use it as a dressing, you can also use it as a bandage. So let's go down here and talk about bandages and some of their uses. So we've got bandages and uses. So a bandage can be used to hold a dressing on. You normally see that with roller bandages. You can use those to roll up and keep a dressing on. That can be used to prevent swelling. So you may have seen somebody that's twisted their ankle and they've wrapped it up. The reason that's important is because if tissue swells too much, it can cut off circulation. So that's one reason you would want to prevent swelling. It's just like when somebody gets bit by a snake, and let's say it's a hemotoxin, maybe by a pit viper, and somebody gets bit by it. It can cause extreme swelling in that case, is because the tissue is being destroyed and cut off circulation below the site. That's the reason sometimes doctors will cut the skin to allow the muscles to swell so that they don't lose circulation. Well, the same thing can be said for a bandage. You can wrap up a limb that you may have sprained to prevent it from swelling up too much so that you get adequate circulation to the tissue below the injury site. So it can be used to support or stabilize. So something like a triangular bandage is used to support a limb, like if you did a soft splint where you've got the arm in a triangular bandage like a sling would be an example of support. So a sling would be a good example of a soft splint that you could use a bandage to just hold the limb in place, and you can also use it to control bleeding. So you're going to have some sort of dressing underneath it, and then the bandage can hold the dressing in place. Anytime you put a bandage on, especially if you've tightened it down, you want to check for circulation. So you want to look at skin that's maybe it's turning blue or pale. That's an indication it's not getting good circulation. It's cold to the touch. It's not getting good perfusion. You know, we talked about perfusion in another chapter. So if you like squeeze the finger, it takes a long time for the blood to rush back in. So all of those are indications that you're not getting good circulation. Let's go in and talk about types. We talked about types of dressings. Let's talk about types of bandages. So we have different types of bandages that we can use. We have a roller bandage. And if you see any of the videos that students have done, you'll see them using roller bandages. Some of them are using elastic roller bandages. Right now I'm talking about non-elastic roller bandages. And those are good. These are really good for burns. And they can be good just to hold dressings in place. So they're really good for just holding dressings in place. And we've got self-adhering. So these are good for convenience, you know, because they conform to the body. They're easy to use. Can also be called conforming. Easy to use. You can easily apply them. So self-adhering, you got to be real careful that you don't actually get the adhering portion of this on the wound, and I'm sure you've experienced that with like a Band-Aid, and you've got larger ones that are a lot larger than a Band-Aid. Then you have Gauze Rollers. So just like a roller bandage, they're cotton, so they're pretty absorbent, and they're non-elastic. Let me scroll back up here so I don't run out of room. And then we have elastic roller bandages. I like these. They're really good for compression, especially if you're dealing with some sort of sprain. They can be good for holding dressings in place. I know your book kind of warns you away from them. They can be good. It's how you use them. You've got to be real careful with elastic roller bandages. The advantage of them is even if you're using them for external bleeding, you don't necessarily have to tie them off. Sometimes they'll self-tighten, but that's also the danger of them. They can self-tighten so much that they cut off circulation. So you got to be real careful with elastic roller bandages, because they will self-tighten and can cut off circulation. So you always want to make a couple of checks for circulation if you're using these, because they will tighten down. So not typically used for wounds, but they can be used for wounds if you need to. And then of course you have triangular bandages, and those are the ones that you always see like Boy Scout videos or Boy Scout books or whatever, where you're using them for splints. they've been shrunk down, so they're kind of pre-shrunk, and so they're not going to get any smaller, and they're good for stabilization. So real good for stabilization. For like soft splints, like a sling. This is what I was talking about earlier. So real good for slings. And let's see here. I believe I'm missing one. I think adhesive tape. Adhesive tape. This can be real good if you have some dressing, because you need to make a large adhering bandage, and it can be convenient. So the only problem is you got to be careful. Some people are allergic to some types of adhesives, just like you have latex allergies. You have some people that are allergic to them, and it's can be a pretty secure roller. So you kind of roll it on, really convenient. But you got to, like I said, you got to be careful with the adhesive in it, and some people can be allergic to that. So I'm not going to go into any more detail. It'd be better for me to make some videos showing you how to apply it, so that you can visually see what's going on. I do have some where students have made videos, and some of them are using one of my favorite techniques. They are using elastic roller bandages, but they are checking for circulation. It would be better if they just used a roller bandage, but they didn't have access to it, so they just used an elastic roller bandage. So I hope this was useful to kind of define the difference between a dressing and bandages. Essentially, the dressing is what you're going to apply directly to the wound, and then the bandage is what's going to hold it on. And some of the bandages have the dressing built in, especially for the self-adhering like Band-Aids and stuff. So I hope this was useful, and I will see you in the next video.